In 2012, the Centers for Medicare and Medicaid Services introduced Accountable Care Organizations, also known as ACOs. ACOs assist doctors, hospitals, and other healthcare providers to more effectively coordinate care for Medicare patients. The Medicare Shared Savings Program for ACOs creates incentives for providers to work together to treat their patients across many healthcare settings, including doctors' offices, hospitals, and long-term care facilities. CMS encourages providers to voluntarily participate in ACOs in order to increase their patients' quality of care and lower the overall growth in healthcare costs. ACOs must meet all Medicare eligibility and program requirements, must serve at least 5,000 Medicare fee-for-service patients, and agree to participate in the program for at least 3 years. The regulations require the ACO to have in place processes and procedures to promote evidence-based medicine, beneficiary engagement, and coordination of care. To assure program transparency, CMS requires ACOs to publicly report certain aspects of their performance and operations. The statute also requires each ACO to establish a governing body representing ACO providers, suppliers, and Medicare beneficiaries. The ACO is a patient-centered organization where the patient and providers are true partners in care decisions. The goal of an ACO is to deliver seamless, high-quality care for Medicare beneficiaries that eliminates waste and reduces excessive costs through improved care delivery. CMS establishes quality performance measures and a methodology for linking quality and financial performance that set a high bar on delivering coordinated, patient-centered care by ACOs. CMS emphasizes continuous improvement around the three-part aim: better care for individuals, better health for populations, lower growth in expenditures. CMS plans to monitor ACOs to ensure their compliance with eligibility and program requirements. The monitoring plan includes analyzing claims and specific financial and quality data, as well as quarterly and annual aggregated reports and beneficiary surveys. There are 33 core measures that span 4 quality domains: patient experience of care, care coordination, patient safety, preventative health, and at-risk population. Before an ACO can share in any savings created, it must demonstrate that it met the quality performance standard for that year by reporting through a combination of clinical quality measures and patient experience of care surveys.
If my doctor is in an ACO, can I still see whichever doctor I want?
Absolutely. If your doctor participates in an ACO, you can see any healthcare provider who accepts Medicare. Nobody, not your doctor, not your hospital, can tell you who you have to see.
What should I expect if my doctor is in an ACO?
Over time, if you see a doctor or healthcare provider participating in an ACO, you may notice that. You don't have to fill out as many medical forms that ask for the same information. The healthcare providers that you see all know what's going on with your health because they communicate with each other. You don't need to repeat medical tests because your results are shared among your healthcare team. The providers participating in the ACO work with you to make sure care decisions reflect your preferences.
How will an ACO lead to better care for me?
When your healthcare providers have access to your health information and are able to share that information with one another, they can give you better, more coordinated care. Each of your healthcare providers won't only know about the health issues that they've treated, they'll have a more complete picture of your total health. With an ACO, you're the center of care. Healthcare providers have reported that a barrier to improving care coordination is lack of information. They don't know about all the other healthcare services provided to the beneficiary. MHT ACO equips providers with quality and cost metrics to help coordinate that care and earn shared savings. Providers also play a major role. Doctors and their staff work with the ACO to ensure patients, especially the chronically ill, get the right care at the right time. MHT ACO and providers both work towards the goal of creating a patient-centered organization where the patient and providers are true partners in care decisions.